When a patient comes for surgery, they want you to have the best equipment possible. Lativa has really brought that to the next level. The whole team can see what's going on, we can mobilize, and we can get things done as quickly as possible. My name is Matt Schlenker. I'm a 42-year-old. I'm an ophthalmologist, a glaucoma and advanced anterior segment cataract surgeon, and I work at Toronto Western Hospital. Because glaucoma is such a devastating and a common disease, we have an opportunity to do better for our patients. If we can diagnose glaucoma earlier through screening and more accurate diagnostic measures, we can make sure that they get the monitoring and treatment they need. Analyzing for progression allows us to figure out who needs to escalate their treatment and can really help the patients understand a largely asymptomatic disease earlier in their disease state. Most patients who are diagnosed early will not go blind in their life with appropriate follow-up and the care we have nowadays. Glaucoma Workplace has revolutionized the way that we can analyze our glaucoma data. It brings the structure and function into one place, and it gives the doctor a dashboard to manipulate these to assess for progression over time. I do look at the OCT images, the visual field images, and the fundus images on their own, but then in the Glaucoma Workplace, you can put them all together on one screen, so you can assess for structure-function correlation. So you want to assess to make sure that the pattern you're seeing on your OCT fits with what you're seeing in the visual field. And of course, you're going to pause if those two modalities are not fitting. Once you've established some baseline testing, you can actually quantitatively analyze that data over time. There's also a bunch of different ways that you can look at different aspects of the images. So for instance, on the OCT, there's something called a deviation from normative map, where you compare the images compared to the database of quote-unquote normal patients. Something I also like is, let's say a patient is sent to me with a really high eye pressure, and we're able to stabilize this patient through either conservative measures or surgical measures. At that point, it's time to reset the baseline, because we know that we have a better control of the patient's glaucoma. And we can do that right on Glaucoma Workplace, right in front of the patient. We can see that downward, and it's very satisfying, I think, both for the physician and I'd like to think for the patient as well, to see that downward trajectory all of a sudden halt and become stable. It happens many times in my clinic. A patient will go in, they'll quickly have cataract surgery, they'll maybe have a lens that actually diffracts light put into their eye, and then they don't see well after. And it turns out that the cataract was either a small part or just a contributing part of the problem for their vision loss, and their glaucoma was just as big a problem. And you can imagine the patient's surprise, shock, disappointment, and sadness when they have their cataract surgery and realize A, they don't regain as much vision as they want, B, the vision they've lost is irreversible, and C, they may have not had the most appropriate lens in their eye for their whole situation taken together. All the more reason that when patients have cataract surgery, that this is part of their surgical planning in terms of the lenses and includes of adjunctive trabecular bypass microinvasive glaucoma surgery. As we do better diagnostics, we do better progression analysis, and we do cleaner, safer surgeries for our patients. We're in an era of microinvasive glaucoma surgery where we are striving for less tissue manipulation, slicker surgeries, faster recoveries, better quality of life, much more of a stepwise approach. When a patient comes for surgery, they want you to have the best equipment possible. They're anxious, they're going into the surgery. You can feel confidence when you have a great viewing system going in there that you're going to be able to deal with whatever comes your way. Lativa has really brought that to the next level. It is a beautiful 3D viewing system. I really like the optics of the Artivo. I think that helps us to have precise surgery. We also have very fast focus, zoom, XY capability on it. I love the recording system. We do this to all of our cases to really assess our surgical process and also our outcomes. Also, we have the opportunity to integrate the ZEISS biometry that we were taping in our clinic to measure the patient's eye and put that into the Artivo system as well to get better real-time feedback to make sure that we're putting the proper lens in, and also in the case of toric lenses, putting it in the proper position for astigmatism management. Making sure that the whole team can see what's going on creates this for a more relaxed and communicative environment. Everyone in the room can be immersed in what's going on just in this little eyeball. It's just a beautiful way to involve the whole team, both from a training perspective and in terms of making sure the patient is getting timely help from, say, the nursing staff. Everyone knows exactly what's going on, and we can mobilize and we can get things done as quickly as possible, which I think is really in the best interest of the patient.